Assalamualaikum warahmatullahi wabarakatuh. A very good day to all of you again. Hello, guys. So welcome back to the PHC525 Medicinal Chemistry. And I'm going to follow up from the video that we had yesterday on if you had a look at the generally, you had already seen how the receptors are all spread out in our body in terms of antiemetic, yeah. And I've mentioned about the ondansetron, yeah, not satrin, ondansetron, yeah, or gravisetron. So they've been used in many clinical scenarios to reduce nausea and vomiting that experienced by many chemotherapy or cancer patients that undergo chemotherapy. There are the second category of drugs that you can use for nausea and vomiting. These are called the H1 receptor antagonists. So we're going to have a look at the H1 receptor antagonists in here. If you look at the notes I've given to you, these are the notes here. In general, if you see our entire nervous system, there's a lot of receptors involved. Histaminergic, cholinergic receptors, adrenergic receptors, dopamine, yeah, receptors, and these are all non-selective. If you have a drug that is non-selective towards any of receptor, in other words, it can actually work on all receptors, what you tend to get the central effects. You tend to get this, sedation, drowsiness. People really, after taking a drug, they simply fall asleep. All right, dry mouth, for example, blood vision. So these are the peripheral cholinergic effects. So the search for selective. So from non-selective, all right, from non-selective, we want to look for selective drug that targets only the histamine receptor, especially the H1 receptors. This is what we're looking for. All right, so if you look at it in a sense, H1 antagonists, let's look at the pattern or the framework of H1 antagonists. Okay, so the general structure is, if you look at it, you'd find two aromatic rings. Okay, aromatic 1 and aromatic 2. Okay, and they usually say a phenyl ring or a substituted phenyl rings. They are usually like that. Okay, and then it's usually, yeah, this is important, this part, the X label there is quite important. That is usually changed or modified. Usually it is used, X is equivalent to, example, a carbon, a nitrogen, and so on. We'll see later. And then the X, which is modifiable, all right, is linked by a spacer, all right. Usually it's a 2 or 3 carbon spacer, all right. And usually the most optimal so far is 2 carbon, is a methylene, all right. And then that spacer will link the one of the atom on the left hand side with an amino group, a disubstituted amino group. Okay, so that's the general structure of this H1 antagonist. And I have mentioned here, yeah, the role of this H1 receptor antagonist, they do not block the receptor. So what they do is that they behave as an inverse agonist. They bind to the inactive conformation of the H1 receptor, the G protein, and G protein is quite complex. It's a huge system of receptors, yeah. And once they bind to the inactive conformation of the H1 receptor that modify or change the conformation of the receptors and shifting the equilibrium to the inactive state. So it becomes really inactive. It doesn't really change or able to accept the neurotransmitters, yeah? In this case, the histamines or others as well, all right? So that's how H1 receptor antagonists act or behave, yeah, in the body. Okay, and now we're going to see again, referring to the patterns, the trends over from the, if you take, there's in the H1 receptor antagonist or H1 antagonist, there's usually in general, when you work as a pharmacist, you would see the first gen, you would see the second gen. Okay, the big difference is that the first gen and second gen is that the first gen, it put people to sleep, basically, and the second gen is essentially non-sedative. So that's makes it really awesome to a lot of people, because they can continue working without feeling sleepy or drowsy while they work. So that's fantastic. So let's see the trend from the first gen right to the second gen. So we're going to have a look at this first one. So the first one is, as you see here, is called the family name, yeah, is called ethylene diamine. And this antihistamine, if you see the X here is a nitrogen, yeah, and the spacer is a ethylene. You see CH2 and CH2. And this is a phenbenzamine, and if you see at the end, there's a 2-methyl group attached to an amino group. And if you see here as well, there's a phenyl group as well at the end. So it's a very simple antihistamine, all right? And this is very sleepy, all right? So now they know that this particular drug has a good effects onto the H1 receptors. You get all these things, effective against allergies, hay fever, rhinitis, food allergy, and so on. But it make people go to sleep. Not the side effects that you want, really. So then they took on this particular, pattern. Again, I'm talking about pattern or framework. Yeah, I would rather that you use framework or core or the lead structure. That would be a better words. Pattern is just to give you an idea what's the big idea of what it is in medicinal chemistry. And then we move on to the second family in this first generation. This is ethanolamine, all right, or diphenhydramine. This is a very popular drug, and let me draw this one out for you. So here is actually carbon. This is actually ethanolamine, yeah, and that's hydrogen in a sense. So that's important. The C single bond O is new in here, all right? And I've mentioned earlier that is a biosteric replacement to the this amino group, all right? And then now, if you replace this particular carbon to an S, yeah, if this carbon is changed to an S, the activity, its activity drops. That's the problem with replacing the carbon with a sulfur or thio group. So this has to be this way. This carbon has to be there in a sense, linked to two aromatic groups with a linker, yeah. And you have the same, if you see in terms of structure, it's the same. Also, you have this dimethyl amino group, same like this as well. All right. Okay. So in terms of the uses, talked yesterday about the travel sickness. So dimenhydrinate or diphenhydramine. I mean, I like to use the diphenhydramine somehow. But you see, both are actually being used in the market when you work as a pharmacist. Actually, yeah, it's been used quite a lot. You can just go to a counter and you can actually buy the dimenhydrinate, yeah, to treat motion sickness, to treat any travel sickness, and it's quite cheap as well. All right, okay. So now let's look quickly at the SAR of this ethanolamine family, in a sense. In terms of, it's because of its being the first generation, so it's not that selective. Yeah, I have mentioned earlier. As we move around the trend. Yeah, they're looking for more selective antagonists against this receptor. So the antihistamine activity still versus the anticholinergic activity is actually, if you look at it, yeah, let me just have a look going up. This is looking at the effects of increasing the alkyl chain length. All right, alkyl chain length, we're talking about the part of the molecule R1 and R2, and here the effects is that if at R1, okay, if you increase the chain length, yeah, more carbon added to the R1, what happens is that the H1 effects is actually reducing. Okay, let me put it as, so the H1 effects is coming down, drops basically. So the longer the chain at R1, okay, the less the effects. In terms of the cholinergic activity, this is not what you want, because what we really want in this antagonist is to have a higher affinity towards, or give a better activity in terms of agonizing the receptor, H1 receptor. So we if possible, if you see, we don't want much of other activity to come in. It doesn't want it to interact with other receptors. So in this case, it still interact with other receptors. If you see in R1, the cholinergic effects, as you increase the chain length, as you go down methyl, ethyl, isopropyl or isobutyl, the effects goes higher. It increases. Okay. And the SAR of this ethanolamine family, if you see now, we going to look at the R2. Okay, so for the R2, if I can do that, as we increase the carbon, number of carbon, all right, the H1 still not much differ. It sort of like, it's okay, yeah, not much change basically. It increases the antagonism of the H1 receptor. It increases, it gives a good trend as the number of carbon increases. And the good thing is that if you increase the number of carbons in the R2 position, the cholinergic effects decreases with the increased number of carbon. All right, so what they have found is that at R1, if you increase the chain length, the anti-H1 activity decreases, whereas it increases at for the anti-cholinergic activity. So not much changes in a sense. So what happens is that when the number of carbon increases in this way, all right, they have found that the spatial orientation of the two rings, yeah, this spatial orientation of these two rings, okay, may change as well. If you see these two rings are actually they are close to each other. They are just linked together. If you see here, these are linked together by a carbon here. So that they're actually quite close. And if you see as well, the R1 happens to be here, R1, and then this is also R1. Yeah, they might actually clashes. They like the helicopter ring, the helicopter blades. Yeah, if you have something jutting out from the blade, they might clash because they actually will rotate. These actually are flexible, so they could actually rotate. And if they have larger substituent on the side, on the side here, all right, they might actually clash and affect the activity. The substituent on the aromatic ring here has effects on the activity of the H1 antagonist. Yeah, but the rest should maintain as it is. Yeah, it shouldn't be any change at all in this ethanolamine family. All right. The good thing here is, as mentioned in these notes, is that it has a shorter half-life. In a sense, it's very good, and it has a wider safety margin. So the window is bigger, so that allows if any error in taking the medication, this H1 receptor antagonist, or taking. I mean, some people take a bit too much to treat their travel sickness for the dimenhydronate. It shouldn't be much problem, okay, except for that they go to sleep a bit longer.